Good morning, good afternoon, good evening, wherever you happen to be. My name is Firoz Manji from Daraja Press. Welcome to the show on organizing in a time of COVID. Today, we are going to be going to Uganda to speak to Lyn Ossome. Lyn is a senior research fellow at the Makerere Institute of Social Research at Makerere University in Uganda. She has a PhD from Wits University, and her specializations and taught courses are in the field of feminist political economy, feminist political theory, with a particular research interests in land and agrarian studies, gendered labor, queer feminist histories, and the political economy of gendered violence. She's the author of a very, very interesting book, Gender, Ethnicity and Violence in Kenya's Transition to Democracy. Well, when is Kenya's transition to democracy, I wonder. Anyway, it's called Gender, Ethnicity and Violence in Kenya's Transition to Democracy, States of Violence, published by Rowman Littlefield. And I can show you the details of that book just here. So wishing you a very warm welcome, Lyn. Welcome to the show. Thank you for sparing time to join us. Lyn, maybe we can start with asking you to give us an overview of the situation in Uganda in relation to COVID-19.
Yeah, well, as you probably know, the first case of COVID was declared in Uganda in towards the end of March. I think the 22nd of March. I think that's when the first case was declared, and then in April. Sometime towards the late March, then the government decided to take the route that other countries had already been taking of a total lockdown, which is going to be over a period of 2 weeks. We are just over the 1.5 week mark. As of today, or as of 2 days ago, there are 53 cases of confirmed coronavirus patients. No deaths have been reported yet. And I was reading a news item today that says that the curve is flattening in Uganda. And of course, this article refers to cites the government officials as saying that the approach they took was based on a modeling that said that if they did not take these strategies around a lockdown, a total lockdown, that we would be seeing a doubling in the cases, and that by end of April, Uganda would have had about 18,000 cases of COVID by end of April, and just over 500 deaths. Whether that is true or not, of course, this is based on modeling by scientists. But apart from that, the government decided to take the route, to take a public health approach, which is contrasted with a state of emergency approach that was declared, for example, by Ethiopia this week, based on having found 51 cases. Of course, the difference is that a state of emergency then allows the government to suspend the constitution in one way or another and regain control over the situation. So Uganda's approach has been based on the public health. Act and in our public health approach.
Can you elaborate on what the public health approach is and how it's different from what, for example, neighboring Kenya has been doing?
It's basically I don't think it's much different. I mean, of course, one is the question of the social distancing. You know, the things that are immediately available to people that can be enforced without, overly legislating people's lives, which would imply resorting to some, constitutional divergences, which a state of emergency allows the state to do this. So it's the social distancing. It is the requirement of certain public health measures, the wearing of face masks, the mandating all public spaces that are still allowed to operate. Supermarkets, of course, hospitals have not been shut. Restaurants are allowed to still operate on the basis of takeaway foods, markets, and so on. So mandating these kinds of measures, and of course enforcing them in certain ways. And I know we'll be talking about the question of violence or how the state has tried to enforce this. Of course, there's a lot of public service addresses going on, public service, public messages led by the president of Uganda in many ways, but also his, the people that are working around him. So it's all these measures to create a certain kind of awareness.
Okay, so but it seems to me that this is a fairly standard approach in much of Africa. Social distancing, washing your hands, using soap, and other things like alcohol to clean your hands and so on. In principle, all sounds very, very good, but the thing that has been arisen in a number of the interviews that we've conducted from people from Africa as well as from Brazil and elsewhere is that for the majority of people who live in shacks, the dispossessed, the landless, social distances doesn't make sense since they're living on top of each other. Is that the case in Uganda?
Yeah, I mean, there's a question we have to pose, is that are countries too poor to enforce or to stop social population movements? And the answer is no, is yes. It's just, structurally and infrastructurally, it's impossible to stop people from moving. So, just even the practicalities of enforcing this, that it will be adhered to, it seems to be a message that is targeted towards quite a small population, maybe more intense in certain places. It might be more intense in Nairobi, where we see a very, the slum conditions in slums and low-income housing are, very intense. Of course, we have such living arrangements in Uganda too. But that's a question we have to ask, and that's, I'm sure no government that is enforcing this is not aware of the constraints, and so in Uganda, we hear almost an apology every time the health minister addresses the people to say that these are extreme measures, these are difficult measures, but we have to do it for our own safety. So there's a way in which the public is being enjoined to, to sign on to our own kind of incarceration in a way. But they forcefully pushed back the discourse to the people, to then nod and say, yes, it is for our own good. We see this as a tactic used a lot.
But you talk about Uganda being poor, and we can discuss later on about the resources actually at Uganda's disposal. But what seems to me in common in many countries is that the principal method that is being used is to militarize the street, to securitize the street. In other words, social expenditure is being delivered, it seems, on that. In other words, there is a lot of money being spent on arms and police and patrolling, rather than on protection as such. Is that happening also in Uganda? Certainly, we've seen it in Ghana, we've seen it in Kenya, we've seen it in Ethiopia, we've seen it even in South Africa. The militarization of the street is quite substantial. What's your experience in Uganda?
Okay, so here is my roundabout way of responding to this. One is the moment we appeal to the state for anything, the moment we've seen it with cases of, when you look at sexual violence in South Africa, for example, especially, in the last two or so years, when we've seen an intensification of homicides and femicide and all forms of gender-based violence. And the response, at least the immediate response of women, of feminists, of activists, was to call on the state and say, you have to do something. And of course, the state's response has been to say, yes, we are going to put out more security officers and stuff like that. But and it happens gradually. In short, when you call on the state for a solution, that has always been the immediate kind of weapon in the hands of the state. Uganda has already been characterized, and I say characterized because I think in how it manifests in reality is another thing, but it has been characterized as a highly militarized state. So calling on the state or turning to the state and saying that you have to do this, it's not just, people are not just telling the state that you need to provide food, but that you need to, the state is responsible for enforcing this lockdown. So it's not surprising. What I'm trying to say is that it's not surprising that we are seeing, of course, this surge in police violence, state-perpetrated violence against different groups. Whether it has to be like that, that's another question. And of course, the state has had to respond. In Uganda, in the first weeks of the lockdown, we saw quite a number of cases, and there was an outcry. In the last week or so, it has been much less so. The president himself says in a very kind of off the cuff way that no, you don't have to beat people, and you don't have to enforce it like this. But what I'm trying to say is that everywhere we are going to see this as this is the tools that the state has. It is pragmatic on their part, it is inconvenient, and it is a source of an outcry around the violation of rights. There's also an intense suspension of rights at this time, everywhere, whether it is the freedom to move, to associate, and all that. And I think when we see it in that larger context, then we kind of think of our responses and the amount of anger we redirect in this regard. It is not.
One of the features, I think, of the militarization and securitization of the streets has been that it is targeted not so much at the middle classes as the most impoverished, and it's sometimes difficult to interpret social distancing as perhaps a euphemism for protecting the elite from the disease-ridden 190, the hoi polloi, and it's something that's apparent not just on the African continent. It's apparent even in the US, with the largest number of cases of deaths is occurring amongst African American and Latino and similar communities. Let me just pursue this issue of lockdown and its impact. One of the things that we're certainly getting many reports about across the world is that with lockdown, everyone confined to a small space, it is often the women who are bearing the burden of that. One, in keeping peace in the home, managing the children and so on, but the consequent increase in domestic violence and violence against children. Are you seeing this manifested in Uganda?
Yes, and let me respond by harking back onto your previous point. You know, when we look at the evolution of this disease or this pandemic, of course, at first, I think globally there was, we saw the initial outrage, regarding why are Africans not, why is this thing not in Africa? Why are Africans not being affected? This was before the first cases were reported on the continent. And of course, the context of that, the historical context of that is that Black bodies are deceased bodies, not white bodies. And the moment we start seeing the cases manifesting on the continent, then it shifts. And you're so right in saying, is the lockdown, is the social distancing to protect the middle classes, the rich? Because then, again, wealthy bodies are not this. Now it is poor bodies that are deceased bodies. And then we bring it down to the household, and, we are seeing, of course, the contradictions of the crisis of social reproduction that capitalism has produced over, a long period of time. Feminist economists have been talking about this, and I'll talk about this. But yes, in the immediate term, of course, one of the things that we are seeing and we are going to see, and this is even in middle-class households, is a retraditionalization of gender roles, where, you're stuck in the house. It doesn't matter what barriers or what glasses you have broken, to what glass ceilings you have broken to exit that space or to arrange care labor to allow you to work. Now you're stuck there. And women, I was talking to a friend in the morning who was telling me she has to do, where her kids could be fed in school during the day. Now she has to take care of the kids. She has to cook 3 meals a day. She has to work. So we are seeing that it doesn't matter what kind of household you are in. It's more intense in some households than other households. But the question of social reproduction and what is happening is an important one. And of course, it's a big part of the discussion that is going on. The way I have thought of of course, social reproduction, is the work that happens to reproduce labor, to reproduce the household and even the community, predominantly unpaid, and even when it's paid, like in middle class, in households that can afford domestic labor, it's very undervalued, it's paid very little. But the state also takes on a certain chunk of social reproduction through welfare or welfarist policies, and corporations also take on a certain chunk, the market itself, through things like providing childcare and so on. So it is spread across the realms of the family household, the market, and the state. What we are, and that is, so I say this to my students a lot, that the fact that we are living in a system of massive exploitation and dispossession, which are, people are being expended from labor en masse. Our economies, our countries are made up of a huge labor surplus. Someone is looking after these people. And I tell my students, the fact that we are not meeting dead bodies on the streets, people who are dying of hunger, means someone is carrying the burden of looking after those who have been kicked out of the labor market. Now you can imagine how much more intense that is now, because that section of care workers, that section of household labor that has been carrying that burden of social reproduction is now also locked out. And I'm talking of the informal traders. I'm talking of daily wage workers, people, women who have to do the work, care work, like commercial sex work, in order to support their households, and so on. They have been locked out of those realms that they have been drawing on to subsidize the state, but also to reproduce labor for capital. The question I'm sitting with now is, where are these people turning to? What is happening to households? We can only imagine. We can talk of the kinds of responses that the state has been called upon, and civil society and private citizens have been doing, which brings me to, and I want to tie this into the question of this gendered labor as an agrarian question. Because, we think of land now, there's clamor for land everywhere. In places like South Africa, it is a huge debate. And increasingly, we've been thinking that we're not talking about land for accumulation, or we're not talking about land only for development. We are talking about land because for many agrarianized households and economies, it is really the last bastion of survival. And now here in Uganda, I can imagine, I also always think, in my own observation, and I can't generalize this for all of Uganda, but talking of central Uganda where we are, my sense has been that the idea of absolute hunger doesn't exist, precisely because, wherever you walk, you will come across a matoke, the banana tree that is a staple here. And people can draw on, just subsistence kind of land for subsistence purposes. And now we are seeing that. We are seeing that, how much longer the state is provisioning in small ways. There are private citizens mobilizing, provisioning. But in the long term, this debate around land and how it functions for us, the very basis of survival for many, many households, is coming in stark relief. And it's very related to this question of what is happening with, with the survival of households and the social reproduction. So that is on the question of food and provisioning. Of course, then there's the question of violence, the other question you posed. And yes, there have been reports. I was seeing a report that suggested that about this had looked at this came from a women's organization that had looked at about 13 districts in Uganda, and they say that on aggregate they're seeing about 13 cases of domestic violence are being registered daily. And part of it is that we have to see it. It's not, the way we look at violence, at least the way I've tried to look at violence is, it's not that it suddenly, COVID and this lockdown has provided an opportunity for people to then start beating their partners. No, it is that there are moments that intensify all the kinds of tensions and contradictions that we are living in. It is the pressures that we experience that are let out on a daily basis in other realms are now extremely intensified and locked into the household. And so, it is not surprising that we are seeing. In my own work, I've looked at the context of, say, when I looked at the context of elections and why we see a spike in the violence, it is because there's there's an intensification or a meeting of social and cultural and political dynamics in very small, intense spaces that then implode in the form of different forms of violence. Sometimes it's not targeting women as women. Sometimes it's targeting them as diseased bodies. Sometimes it's targeting them as members of certain ethnic communities. Sometimes it's targeting them as foreigners or outsiders, people who are not belonging. So we see all these kinds of social tensions that are normally diffused becoming very intense in periods such as this.
So there's this intensification of violence and oppression and the conditions of lockdown, as well as violence from the state itself and its forces. One group that has faced particular violence over the last few years, for which Uganda has a somewhat infamous reputation, is of course members of the LGBTI and other communities. Could you say something about what they are facing today under this intense lockdown and what the implications of that are?
Okay, so I haven't seen any sort of concerted attention directed towards the LGBTI community as a community. Partly is that we are also in the immediate response at this time is a response to the economic cost of this pandemic. It is very difficult. Economists know this, but also political scientists know this. And this is the long-standing debate between oppressions that we characterize as based on culture or a cultural manifestation, and those that we characterize as belonging to the political economy. And there has been an attempt to separate this. I think that we can and we should see them together. But in the immediate term, the the economic cost is the main focus, is how do we provision for people. So accompanying that is the question of how do you appear to the state at this time? Who is the state responding to? The state is not responding to identity groups on the basis of identity. So they are not the state. Even the question of women, it is still on the sidelines. Activists, women's rights activists, feminists, we are still talking on the sidelines. The state is not responding to us as women. When this question of domestic violence was posed to the president, his response was very flippant, but it's a representation of what I'm trying to say. It's not responding to groups as, there's no kind of community, marginalized community that is coming forward and saying that you have to respond to us in this way. The state is responding to people based on their sort of census populations, which is populations that are categorized as labor, people who are living in informal settlements, and so on. So class, more than anything, is active. That said, and this is an analysis that the queer community, the LGBT studies have grappled with, are still grappling with. When we talk of violence that is directed towards LGBT communities, it still remains very difficult to especially when you look again at South Africa, which is where LGBT rights are written into the constitution, but where we see the very high levels of violence against these groups. But that violence, most of the people who suffer that violence are Black, live in townships. It's not that what has been called differently collective rate control, affected middle class LGBT people as much as working class people. So then we are left with the question is, are people being targeted on the basis of where they live? Can you rule out the fact that the violence you're suffering is because you are living in an area that is actually very violent? And this is a question that you can pose here too, but I've not seen any kind of direct attention to any interest group, actually, any kind of a separate group. It has been based on states, how as people who claim rights as citizens or people within in Uganda, how do you claim rights? How do you appear to the state? And the state responds to you on the basis of how it actually counts you.
So if I understand what you're saying, it's the characterization of the Black body, the impoverished, as being the diseased bodies. It's not unfamiliar to those of us who were brought up in white settler states, the colonialism, where exactly the same presumptions. Nairobi's structure, for example, was created on the basis of keeping the Blacks out. Down by the river, where they suffered all kinds of diseases, and health services were essentially designed to protect the white. Today, it's protecting the middle class, perhaps. But in what you're saying, it seems to me that that the state has a very clear idea about what it wishes to target and how to deal with this and take advantage of a pandemic. I mean, what's clear in many countries, there's a lot of discussions about, and Arundhati Roy, I think, put it very beautifully when she talks about that we are coming into a portal and we have a choice, which way do we go? And what's your view about what the Ugandan state is going to take advantage of this situation. You know, the Naomi Klein's shock doctrine. Is this something you think that the state is operating to create new conditions of domination?
I mean, Uganda is going into an election year, 2021. And I don't think it is by mistake that part of the lockdown regulations has been that, no private donations. If they announced that if you want to give out food or whatever, it is centralized to the resident district commissioners. So, the president will say, take it there, and even if you want to appear on TV, we'll give you a photo of. But of course, we are seeing this, there's a very real way in which the space is being cleared, and to say that we are the legitimate responsive agent in this. Everything else is a private citizens initiative, and now is not the time. But of course, accompanying that is a real opportunity for the government, for this the ruling party, for the government to show itself in some way or another, whether it will be a even though it is it's being forcefully implemented, this thing. There is a benevolent side of it. We've seen photos of food distribution in the districts, door to door. We have seen, this very regular kind of conversations in our sitting rooms of the head of state telling us to calm down, making jokes and this kind of thing. But there is a space, and I don't think it is not. Their eye must surely be on the election year coming, and the opposition figures that have been very vocal prior to this pandemic have been as good as silenced. There's just simply no space right now, and I don't know what happens. Of course, everyone everywhere is asking. There can't be an indefinite lockdown. There has to be some decisive way in which movement is allowed again. But I think, it wouldn't be surprising to me if the state uses the excuse of needing to monitor and retain control around containing the disease to also interfere or put limits on the kinds of activity that the opposition can take on. It's very possible. And I think this is the longer term big picture that we have to decide for. Yeah.
Which brings me to my sort of final question, and it's the center of what we are trying to discuss, provoke discussion about in this program, is how does one organize in a time of COVID? What are the challenges? I mean, you've identified the issues, the way people are, the level of oppression, the violence that's going on. And the state planning to use this, take advantage of it. The question is, how do people organize under these conditions? And I mean, one of the most interesting things I've seen is that in Bolivia, those people who live in the slums have said the streets are just as dangerous as where we are living. And so they've taken to the street to organize on that basis. But we are, in a situation where communication is essential, connection, discussion, allowing people to give voice to their grievances the way they see the world, not just the way the state necessarily sees it. So where are the opportunities? What can we learn from Uganda? What can we learn from you and your colleagues in the organizing that you were doing? And what does it mean today to organize in the time of COVID?
Okay, so from a broad historical perspective, when we look at capitalism itself, and the changes over long periods that have forced the state to organize. You know, I've forced the state into some kind of reorganization. You know, the liberal capitalist form. When you look at, you know, this is the passion around colonialism. So the liberal capitalist form implodes and gives way to the state-controlled form of capitalism, where we see the growth of the welfare states in Europe. We see the Fordist model and so on, which then implodes and gives way to the liberal, monopoly finance stage in which we are in now. And this pandemic, will change the world. There's no doubt about it. We are seeing, the state has been forced into an interventionist, mode. We are seeing glimpses of the Keynesian kind of way, not good enough. But we are seeing states that have been forced, their hand has been forced to deal with the question around what it means to build an infrastructure of social reproduction. What does social solidarity look like? We have, the progressive forces have turned the tables and said, no, it's not social distancing. It's physical distancing and social solidarity. But what does it look like? So there is a real opportunity. What I'm trying to say is that, I keep sitting in my corner, and part of me is appalled at it's a very dystopian time we're living in. But there's a part of me that is very hopeful that we have a real opportunity to understand what is the trace, what are the measures, what have the different states been doing? Are there patterns? Are there things in common that we can organize around in different, not just in different countries, but in different corners of the world, especially in the global south? And we have to decide conceptually what are those things. Whether we are talking about, what does subsidizing of infrastructure look like in poor countries, in agrarianized countries, in countries like Uganda, where 80%, about 50% of the GDP comes from the informal economy, and about 80% or 85% of the workers employed in the informal economy. What does it look like? And this is the time, and we have to talk about this intensely. The thing, as I was saying earlier, is that we are intensely now in the economic. We've seen this. It's not by mistake that the frontline commentators at this time are economists, and that is fine. It is an immediate question. This is the response of neoliberalized societies. And, it's as if we are waking up to the fact that there are millions of people literally who are starving, who have not. I am very glad that the poor are back on the agenda, and seriously, everyone is thinking about what do we do. Part of it is guilt. It is the guilt of the middle class sitting at home and thinking, oh my God, someone is starving. Let me behave as if I didn't know our countries were poor. But So the economic question is frontline. It has to become a political question. How it becomes a political question is the thing that we have to think of. Just doing
Yeah.
more. Yeah.
I mean, it's interesting that when I asked you about how people can organize, you turn to the state. Um, but you did use the term solidarity, and I heard one person a few months ago describe solidarity is what love looks like on the street. And if you're not allowed on the street, the question is, how do you give love? How do you organize around love when you don't have access to the street? But those are questions which, I mean, I don't know what the answers are. And I think the discussion about what needs to be done to be able to organize in the time of COVID, I think remains a major one. Lyn, I'd like to thank you really so much for sparing time to join us on this show. It's been really insightful to listen to you, and I'm sure there'll be lots of interest expressed in the things that you've been talking about. Just to give you another plug for your book, which is a really important book, and one I think I would recommend many people to get hold of. So thank you, Lyn, for joining us. I don't know if you have any last words you'd like to convey.
I mean, just on the question of the state, I stubbornly refuse to give up on the state. I obviously think that there is a real opportunity for us to build the socialist elements of the states that we exist in. The question that we keep asking is justice possible within capitalism? That is a big question. But, you know, let us take these times in social isolation, physical isolation, not social isolation, to organize, build our solidarities, and indeed think about what it looks like on the streets. But thanks for having me on. Yeah.
No, it's been a real pleasure. Thank you. That was Lyn Ossome from Uganda at the Makerere Institute for Social Research. Thank you for joining us on this show. We were planning to have another show this afternoon with John Holloway and others, but unfortunately that has had to be postponed. Tomorrow we'll be talking to Kali Okuno about racism and what COVID shows us about racism in the USA. The fact that so many, such a large proportion of those who have died from COVID are from the African American, Latino, and other similar communities. So tune in with us on Sunday, and next week we will have lots more interesting people talking with us. Thank you for joining the show. This is Firoz Manji signing off.